Hello, my topic this week is renal artery stenosis. So, renal artery stenosis is the narrowing of one or more arteries that carry blood to your kidneys. And this greatly reduces blood flow to the kidney tissues, and if it goes uncorrected, it can lead to severe impairment of urinary elimination, fluid and electrolyte balance, and acid base balance. So, renal artery stenosis from atherosclerosis or blood vessel hyperplasia are the main cause of renal vascular disease. Atherosclerosis here can cause renal artery stenosis by the buildup of fat, cholesterol, and other substances of the renal artery, and fibromuscular dysplasia, which is the muscle in the artery wall growing abnormally, can also cause stenosis to the kidney. And most of the renal artery changes are often located where the aorta and the renal artery meet. For your assessment, you can assess blood pressure. The most common symptom you'll see is difficult to control high blood pressure, and that'll first occur after age 40 to 50 in patients without a pertinent family history of hypertension. And other key assessments include poorly controlled diabetes, elevated serum creatinine levels, and decreased glomerular filtration rate. You're going to want to assess the heart rate and also assess for edema along with lung sounds to assess for fluid overload and cardiac output. For diagnostics, these can be determined by magnetic resonance angiography, renal ultrasound, radionuclide imaging, or renal arteriography. The MRA provides an excellent image of the renal vasculature and kidney anatomy. The radionuclide imaging is a non-invasive way of evaluating kidney blood flow and excretion function. And combining radionuclide imaging with the ingestion of an angiotensin-converting enzyme inhibitor, such as lisinopril, will improve the accuracy of the test. And a renal arteriogram makes features of the renal blood vessel visible. For your nursing diagnoses, risk for decreased cardiac output related to increased vascular resistance, as evidenced by blood pressure changes, heart rate changes, and circulation. And the second one is excess fluid volume related to compromised regulatory mechanisms, which would be the renal arterial stenosis. And this will be as evidenced by intake greater than output, generalized edema, and weight gain. And for your planning, the patient will maintain cardiac output as evidenced by blood pressure and heart rate and rhythm within patient's normal limits. Peripheral pulses will be strong and equal with adequate capillary refill time throughout hospitalization. And secondly, patient will display appropriate urinary output with creatinine and glomerular filtration rate levels near normal, maintain a stable weight and vital signs within patient's normal range, and absence of edema throughout hospitalization. So for interventions, renal artery stenosis can be managed by drugs to control high blood pressure and fluid overload using ACE inhibitors and diuretics. Controlling the blood pressure is important but will not preserve function of the kidney. So more importantly, management will be controlled through procedures to restore blood flow to the kidney. And one procedure or procedures are known as endovascular techniques, and these are non-surgical approaches in repairing renal artery stenosis. One example is stent placement with or without balloon angioplasty. And these techniques are less risky and require less time for recovery compared to more invasive procedures such as renal artery bypass. Renal artery bypass surgery is a major procedure and requires 2 or more months of recovery. And a bypass may be performed by either one or both renal arteries. In this procedure, a synthetic blood vessel graft is inserted to redirect blood flow from the abdominal aorta into the renal artery to bypass the area of narrowing. And a splenorenal bypass can also be implemented to restore blood flow to the kidney. Some common nursing interventions to implement include recording intake and output, daily weights at the same time of day on the same scale with the same equipment and clothing, and auscultating lung and heart sounds periodically. And finally, for your evaluation, when evaluating the care for the patient, the expected outcomes are that the patient maintained a cardiac output as evidenced by blood pressure and heart rate within their normal limits throughout hospitalization, and the patient displayed appropriate urinary output with creatinine and glomerular filtration rate levels near normal, stable weight, vital signs within normal range, and an absence of edema throughout hospitalization.